Thanks very much, Michael. Thanks very much to Stephen Shore and the entire team at Real Truth for organizing what has to be an unprecedented conference, and delighted to be with you here again. So as Michael indicated, I'm going to talk to you about ask the question, why do I have Parkinson's disease? And you might ask, why is that an important question to ask? And I'll give you three reasons. One, if you have Parkinson's disease, you probably want a cure for that disease. And I can't think of any disease that we can cure medically where we don't know the cause. I'll say that again. I can't think of any disease where we can cure it when we don't know its cause, at least cure it medically. Second reason is if you have Parkinson's disease, you might want to slow the rate of progression of the disease. And if you know what the cause is, you can avoid those causal factors and likely slow the progression of the disease. The analogy I like to use is if you've been diagnosed with lung cancer, what's the first thing the doctor is going to tell you to do? And that's likely to stop smoking. And third, and perhaps most importantly, if we can answer what causes the disease, we can prevent people from ever getting it. So about 1.2 million Americans have Parkinson's disease today, but that says 320-some million people don't have it. And they probably don't want to have a disease that, in the words of Michael J. Fox, sucks. So we need to figure out what is causing the disease so we can develop more effective treatments for it, so we can slow its disease progression, and so we can prevent millions of Americans in this currently and in future generations from ever developing the disease. The same question should be asked of any disease. So you should ask your clinicians, why do I have colon cancer or breast cancer or diabetes? Because once you start asking those questions, we get closer to getting to treatments, we get closer to slowing the rate of progression of the disease, and we get closer to a world where these diseases can be increasingly rare as opposed to increasingly common. So I'm going to talk to you about three things. One, the rise of Parkinson's disease, which is now the world's fastest growing brain disease. Second, argue to you that Parkinson's disease is largely a man-made disease, a disease of our own making. And thus, because of a disease principally of our own making, we can largely prevent and end this disease. So first, the rise of Parkinson's disease. So the first major description of a Parkinson's disease was by a doctor named Dr. James Parkinson, who was a 61-year-old physician, surgeon actually, in London when he saw something new on the streets of the city. He described 6 individuals, 3 of whom he just observed walking the streets with what he said it was a disease that had not been classified in medical literature, a new disease, a rare disease, a disease that's characterized by a stooped posture, a shuffling gait, and a tremor. And he went to great lengths to highlight that tremor has long been around and described in the medical literature, but this constellation of symptoms was something new. And what's going on in London in 1817? Well, England's it's the height of the Industrial Revolution, and London's the capital. And the streets of London are polluted. And you can see from this picture, it looks like modern day Beijing, where a woman and her husband and their child are all covering their mouths from the toxic effects of the air pollution, which is so dense and so dirty that they can barely see across the street. And since that time, since Dr. Parkinson described the condition affecting 6 people in 1817, 200 years later, the Global Burden of Disease study estimated that 6 million people had the disease. And so how do you go from a disease affecting 6 people to 6 million in just 200 years? It can't be genetics, and it's going far faster than can be explained by aging alone. And if we don't change the course of the disease, the number of people with Parkinson's disease globally is projected to double in the coming generation. And if you look at the map of Parkinson's disease, you'll notice something that's really important, that the rates of the disease vary by a factor of 5. The areas of the world that are most industrialized, like the United States and Canada, have the highest rates of the disease. Areas of the world that are least industrialized, like sub-Saharan Africa in blue, have the lowest rates of disease. And areas of the world that are undergoing the most rapid industrialization, like India and China, have the fastest increasing rates of the disease. China, for example, has seen its rates of Parkinson's disease adjusted for aging more than double in just the last 25 years. So that's the rise of Parkinson's disease. Well, what's causing this rise? And I think this disease is largely man-made. And what do I mean by man-made? I'll give you a classic example, and that's lung cancer. If you look at this graph and you look at lung cancer deaths in the United States in black, and you go out to about 1900, you'll reach the conclusion that lung cancer in the United States just over 100 years ago largely did not exist. Lung cancer, the leading cause of cancer deaths in the United States in 1900, just about didn't exist. It was so rare that when doctors encountered a case, they'd gather around all their colleagues and trainees and bring them around thinking that they would never see it again. They considered it a once-in-a-lifetime oddity. Unfortunately, they were wrong. 25 years after the introduction of cigarettes into the United States in about 1900, you see a corresponding rise in lung cancer deaths. And one of the great public health achievements of the last 50 years has been a decrease in smoking. And you can see 25 years after we stopped smoking cigarettes, we've seen a decline in the number of lung cancer deaths. So think about lung cancer as a classic example of a man-made disease. There are many others, everything from car accidents to likely large portions of type 2 diabetes and the like. And I'm going to make the argument that Parkinson's disease is much of it is largely man-made. And why do I say that? Because the heritability, the genetic contributions to Parkinson's disease are relatively low. This is a figure from a paper from Nature Review Genetics, and my friend and colleague, Dr. Bas Bloom, put it in order from most heritable conditions, such as type 1 diabetes and schizophrenia, to the least heritable conditions, including Parkinson's disease and breast cancer. And even just a note on breast cancer, many have heard about the cancer mutations BRCA1 and BRCA2, and they are indeed important causes of breast cancer, but they only account for 10% of people with breast cancer. 90% of women who have breast cancer have it for reasons that have nothing to do with BRCA1 and BRCA2 mutations. And while there are some genetic causes of Parkinson's disease that I'm going to show you in a moment, the vast majority of Parkinson's disease is driven by environmental factors. And so these are the genetic causes of Parkinson's disease. A few notes on some of them. One, for most of them, if you inherit a genetic mutation in these genes, your risk of Parkinson's disease is much higher. But for most of them, it's less than 100%. So, for example, LRRK2, which is the most common inherited form of Parkinson's disease, your lifetime risk of developing the disease is only about 30 or 40%. Said another way, the majority of people with that mutation, the most common genetic cause of Parkinson's disease, do not develop the disease. Second, you'll see that these conditions are rare. These mutations are rare. And so if you total up, it's only about 15% of people with Parkinson's disease have a identifiable genetic risk factor for the disease. And third, you'll notice that almost all these genetic risk factors have a known interaction with the environment. So this interaction between genes and the environment likely explains those who are exposed to different environmental factors, which ones of those individuals will go on to develop the disease. So what are the environmental causes of Parkinson's disease? Now I'm going to posit that there are three major environmental causes of Parkinson's disease, at least in the United States. Those three causes are: one, air pollution; two, certain pesticides, especially a pesticide called paraquat; and three, a dry cleaning chemical called trichlorethylene, or TCE. So first, air pollution. There's increasing evidence that links air pollution that in our atmosphere to Parkinson's disease. It's the sixth leading cause of death in the United States globally. It costs each of us about 3 years of life expectancy. Each human in the United States life expectancy on average is reduced 3 years because of air pollution. And 95% of the world lives in areas that have air pollution above those deemed to be safe by the World Health Organization. Second are pesticides. The poster child for the pesticide that's linked to Parkinson's disease is a pesticide called paraquat. It's considered the most toxic herbicide or weed killer ever created. It kills the weeds that Roundup can't. It's associated with 150% increased risk of Parkinson's disease. Its use in the United States has actually doubled over the last over the last 5 years. The EPA, the U.S. Environmental Protection Agency's own website says 1 sip can kill, but it's still permitted. And the last one is this chemical. It's called trichlorethylene. It's the chemical that's contaminated the marine-based Camp Lejeune, was widely used in dry cleaners until it was replaced by a very similar chemical called perchlorethylene, or PCE. TCE is a very simple chemical. It's got 6 atoms, 2 carbon atoms, 1 hydrogen, and 3 chlorine atoms, hence its name trichloroethylene. It's associated with a 500% increased risk of Parkinson's disease, according to one twins study. It's known to cause cancer, and thousands of sites, including in Silicon Valley, Southern California, Rochester, New York, where I'm sitting today, and probably near where you live, are contaminated with this chemical. And global use of this chemical is increasing at 3% per year. I'm going to walk you through the evidence for each one of these. So first, air pollution. So we highlighted that Dr. Parkinson was describing the condition, which later came to bear his name, Parkinson's disease, in London in 1817. So what was air pollution like in London in 1800? Well, many of you watched the TV series The Crown, and many of you saw the Great Smog of 1952, which killed an estimated 12,000 individuals in London, led to mass hospitalizations, and actually led to the first Clean Air Act about 4 years later. Air pollution in 1800 London was twice as bad as it was in 1952. So you can see that the levels of particulate matter, those little pieces of dirt and soot that you can see in smog in Los Angeles, for example, the levels of that were twice as high as in 1800 as they were in the 1950s, and 20 times higher than they are today. In essence, people in 1800 London were breathing the air that people in Delhi, India, one of the most polluted countries and one of the most polluted cities in the world, are breathing today. And in addition, if you look at the map of where air pollution first began, it first began in Europe, and then it came into the Americas, and then to Asia, and to date, fortunately, it's been relatively low in Africa. And if you look at the map of Parkinson's disease, you first see it rising in Europe, then coming to the Americas, then increasing most rapidly in Asia, and historically having the lowest rates of Parkinson's disease in sub-Saharan Africa. That's the story about air pollution, which, by the way, is better in the United States now than it was, for example, in the 1970s. So we're making some headway, at least in the United States, in addressing air pollution, but we have much more room to go. Second class of environmental factors that's linked to Parkinson's disease and likely fueling it are certain pesticides. So this is a map of paraquat use in the United States. And so you can see it covers the United States. Just about every state in the United States is still using paraquat. It's a beautiful spring day here in Rochester, New York, and paraquat is likely being sprayed onto fields as I speak. Paraquat, as I mentioned earlier, is associated with 150% increased risk of Parkinson's disease. When you feed paraquat to laboratory animals, it reproduces the clinical and pathological features of Parkinson's disease. It's so toxic that 1 sip can kill, as the EPA indicated. It's been used to commit homicide and suicide, and over 30 countries, including China, have banned the chemical, but the United States has not. I'll say that again. The United States still permits and is increasingly using a pesticide that other countries, including China, have not, that China have banned. And in October of last year, The Guardian, a British investigative newspaper, wrote an expose on paraquat. The headline was, "Secret Files Suggest Chemical Giant Feed the Weed Killers Linked to Parkinson's Disease." And as I'm going to show you, based on that reporting, they knew about its risks of Parkinson's disease and its link to Parkinson's disease for the last 50 years and tried to cover it up, and did cover it up. And this subtitle says that documents seen by The Guardian detail an effort to refute scientific research into paraquat and derail the nomination of an advisor for the Environmental Protection Agency. And that EPA, that scientist that they tried to refute was my colleague, Deborah Corey-Schlechter, who actually just works right across the street from where I'm sitting right now. And they said that her research, a woman, they said that her research was overly dogmatic. If that sounds like familiar terms to be using to a woman that's seeking to change the world, it's exactly right. And so what did the reporters for The Guardian find out? Well, they found out that in 1955, the company introduced paraquat as a weed killer. So this chemical has been around for almost 70 years. First introduced into England and the United States in the early 60s. In the 1966, company scientists, so these are the own company's researchers, according to The Guardian, find that large doses of paraquat in some rats and mice result in a stiff gait or tremors. That's basically a description of Parkinson's disease. In 1974, shortly after I was born, regulators are concerned about workers who, quote, might inadvertently lick small quantities of paraquat residue off their lips or inhale paraquat mist. Rumors circulate almost 50 years ago that some of the EPA favor banning paraquat. 2 years later, an autopsy of farm workers working with paraquat showed degenerative changes in the cells of the substantia nigra. These are exactly the nerve cells that we know are damaged in Parkinson's disease. In 1985, a company memo reports about a scientific article that's showing an extraordinarily high correlation of 0.967. A perfect correlation is 1. So 0.967 is nearly a perfect correlation between levels of pesticide use and Parkinson's cases. The memo warns that paraquat could become a huge legal liability like asbestos, and says that Parkinson's can go on for decades. And they're exactly right. So I shared this information with my colleague, Professor Amit Ray, who's an English professor at the Rochester Institute of Technology, and he introduced me to a new word called agnotology. Never heard of this word before. It was coined in 1962 by a linguist. And agnotology is the deliberate production of ignorance, often for commercial gain. The deliberate production of ignorance, not knowledge, ignorance, often for commercial gain. And the poster child for agnotology are tobacco manufacturers, which systematically sought to cover up, disclose, obfuscate, plant seeds of doubt about the health risks that they knew were linked to their products. In fact, they adopted a slogan of doubt is our product to conceal the health risks of smoking. And the same thing is being applied to paraquat. And if it's being applied to one pesticide that's being linked to Parkinson's disease, we should ask about what other chemicals is this being applied to that are linked to Parkinson's disease, and what other chemicals is this being applied to that are linked to a wide range of other diseases. Agnotology. So trichlorethylene is this very simple 6 atom molecule. Many of you are familiar with water that's called H2O, or which consists of 3 atoms, 2 hydrogen atoms and 1 oxygen atom. So trichlorethylene is just 6 atoms. Was created in created in 1864, and we've been using it since 1920. So think about it. We're using a chemical from the 1920s, which is shortly after when Henry Ford developed the Model T, and shortly after when Oliver and Wilbur Wright flew their first airplane. None of us would be flying in an airplane from the 1920s, and few of us would ride in a car from the 1920s because we rely on engineers to develop safer alternatives. If engineers can develop safer means of transportation, I submit to you that chemists can develop safer chemicals, because trichlorethylene is a dangerous chemical. It has been used to decaffeinate coffee, to degrease metal, and to dry clean clothes. In the 1970s, 600 million pounds of this chemical were used per year, more than 2 pounds per American in the 1970s, and found in everything from typewriter correction fluid to decaffeinated coffee. As I mentioned earlier, it's associated with a 500% increased risk of developing Parkinson's disease. And like smoking and lung cancer, you don't smoke a cigarette and develop lung cancer the next day. There's a lag in the study between 10 to 40 years between the time you're exposed to this chemical and your development or diagnosis of Parkinson's disease. And my colleagues, Dr. Caroline Tanner and Sam Goldman, who are now at University of California, San Francisco, noted that because of TC's widespread use, that the potential public health implications of their findings are are substantial. What's really clear is that TCE causes cancer. According to the World Health Organization, TCE is carcinogenic to humans. According to the Environmental Protection Agency, TCE is carcinogenic in humans by all routes of exposure. So what cancers are really linked to Parkinson's disease? To TCE, I'm going to give you 5. One is liver cancer, kidney cancer, sometimes called renal cell carcinoma, non-Hodgkin's lymphoma, prostate cancer, and multiple myeloma. Those are just 5 for which the evidence is most robust. There's other studies that have linked it to breast cancer, including dozens of male Marines who worked at the contaminated base Camp Lejeune had developed breast cancer and brain cancer in some reports. And many of us have worked with this chemical, and many of us have been exposed to it and don't even know it. These are just some of the occupations that are linked, that are associated with TCE exposure, including aircraft and jet engine mechanics, anyone working in the automobile industry, dry cleaners, embalmers, oil processors, painters and printers, shoemakers, taxidermists, weapons specialists, and varnish workers. And its list of commercial uses is long. This is a partial list: adhesives, carpet cleaners, cleaning wipes, degreasers, film cleaners, glue, gun cleaner, inks, lubricants, pesticides, refrigerants, typewriter correction fluid. And its industry uses are even or similarly long. TCE was so widely used, it was actually used to anesthetize patients, especially to provide pain relief to pregnant women. This is a courtesy of a colleague, Dr. Victor Polshuk, who introduced me to this. And this is a quote from one of the leading journals of obstetrics and gynecology from 1956. Trilene, or trichlorethylene, is a potent analgesic drug. Its margin of safety and ease of administration will ultimately make it a standard agent on all delivery floors. Trilene's wide variety of uses will probably allow almost every obstetrician to find a place for it in its obstetrical practice. And so it was widely used, especially for pregnant women, until the FDA banned this use in 1977. But other uses of TCE are still permitted today. It contaminates over half of the most toxic Superfund sites throughout the United States. And so you can find likely a Superfund site near where you live or have lived. And you don't need to have worked with a TCE to have been exposed to it. TCE contaminates up to 30% of groundwater in the United States, is very frequently released into the atmosphere as well. And when it contaminates groundwater, it can form underground rivers or plumes that can migrate away from a contaminated site. So if the contaminated site is either an industrial site, a military base, especially an Air Force base, or a dry cleaner who's inappropriately disposed of the chemical, or it's leaked from sewage lines, the TCE gets into the soil and groundwater. And just like how radon evaporates from the soil and can enter your home and cause lung cancer, TCE can do exactly the same thing. So many of you have had your homes tested for radon to make sure that your basement, for example, doesn't have high levels of radon. TCE can evaporate from underlying contaminated soil or groundwater into your home, your workplace, or your school, and do so without you even knowing it. And it could have done so 10 years ago, could have done so 20, 30, 40, 50 years ago, and you never knew about it. The poster child for the contamination of drinking water is the Marine base Camp Lejeune in North Carolina. It's one of the largest Marine bases in the country. And from the 1950s into the 1980s, its drinking water was contaminated by TCE at levels that were more than 3,000 times that which are safe, and was contaminated with many other chemicals. And it's led to countless suffering. It's led to miscarriages, babies born with significant birth defects, a cemetery just off the base that's filled with babies who died with congenital abnormalities. It's caused male breast cancer, as I alluded to earlier, caused scores of people, probably hundreds, maybe thousands of people to have cancer, and is associated with an increased risk of Parkinson's disease. But these contaminated sites are everywhere. Michigan likely has thousands. This is a contaminated site in Michigan from an automobile manufacture where TCE dissolved into the groundwater and formed this underground plume or river. And you can see this underground plume or river travels miles away from the initial contaminated site. So if you live on top of this or go to work on top of this plume or have your children going to school on top of this plume, they could be breathing in the pollutant TCE and not even know it. There are numerous sites in New York State where I live. Last year, I visited 5 Superfund sites contaminated with TCE in just 3 days. And I thought when I would go to a Superfund site that I would see, hazmat suits or fences or danger signs everywhere. But I didn't, and you don't in general. This is a picture of a Superfund site in Nassau, New York, which is a beautiful, idyllic town in upstate New York. And you can see there's nothing around there to notify people of the dangers that are likely inherent with a Superfund site. In fact, I saw a little girl bicycling on a bicycle right near this Superfund site in Nassau, New York. Just where I live in Rochester, New York, there are more than a dozen dry cleaners that are known to be contaminated with trichlorethylene or its related chemical perchlorethylene, PCE. 3 of them are about 10 minutes from where I live in suburban Rochester, and a few of them are located about 10 minutes from where I'm sitting right now at the University of Rochester. And these sites are found everywhere. Some of you might remember either the book or the movie A Civil Action in the 1990s starring John Travolta, which highlighted how TCE contaminated drinking water in Woburn, Massachusetts, leading children there to develop leukemia. Many of them died. Dan Fagan wrote a Pulitzer Prize-winning book called Tom's River, describing the contamination of a town in New Jersey, also with TCE, again leading to cancers among children in that community. The good news is that TCE, just like radon, is really readily addressable. So this process by which TCE gets into the groundwater and evaporates into people's homes, schools, and workplaces is called vapor intrusion, and it's remediable. Some of you even have had radon found in your basements and have had radon remediation systems put in. Those radon remediation systems are very similar to what's used for TCE. And what you essentially do is you have a pump that pumps out the air from below your house's foundation and sucks all the TCE out and vents it above your roof where it can be readily diluted into the atmosphere. And this is a picture of Ms. Jane Horton, who lives near a Superfund site in Mountain View, California, one that was contaminated with the chemicals that were used at Intel and Fairchild Semiconductor. She had her indoor air tested, found to have elevated levels of TCE, had a remediation system put in, and now boasts that she has the cleanest air in her home of all of Mountain View, California. So this all suggests that Parkinson's disease is preventable. And why do I say that? There's only one well-conducted study that I know of that's shown that the incidence, the number of new cases of Parkinson's disease is decreasing. And that was done in the Netherlands, which found a 60% decrease in the rates of Parkinson's disease between 1990 and 2000. And I looked back and I looked at these 3 environmental risk factors and found substantial reductions in air pollution, pesticides, and trichlorethylene. Now, these are just associations. I'm not sure if they caused it, but it's worth noting that between 1990 and 2012, levels of air pollutants in the Netherlands decreased by 50% or more. The levels of pesticides that are known to be linked to Parkinson's disease that dissolve in fat in your brain, as many of you know, is covered with fatty substance, dropped between levels of 75 and 90% decreases in pesticide levels in people's fat. And trichlorethylene in the Netherlands had about the lowest level of trichlorethylene in its air of any country in Western Europe in 1981. And Western Europe many nations in Western Europe have since banned TCE. And if you look, that's in the Netherlands. So what's going on in the United States? This is a map created by my colleague, Dr. Allison Willis, and her fellow investigators looking at the incidence or number of new cases of Parkinson's disease in the United States. And you can see that it's not uniform, that there are certain areas of the country, the Midwest, Southern Texas, California, that have higher rates of Parkinson's disease than others. And if you look at the maps of air pollution in the United States and Parkinson's disease, you could perhaps see a correlation, at least I do. I'll let you be your own judge. And if you look at the maps of paraquat use in the United States and the maps of Parkinson's disease, you might see a match as well. And if you look at the maps of releases of chlorinated chemicals like trichlorethylene, TCE, between the release of those chemicals and the map of Parkinson's disease, you might also see a relationship. So this all suggests to me that Parkinson's disease, much of Parkinson's disease is likely man-made. That's due to environmental factors that are common in our environment and are increasingly found globally, includes specifically outdoor air pollution, certain pesticides, especially paraquat, and dry cleaning chemicals like trichlorethylene and perchlorethylene. This all suggests that we can actually, one, prevent and end Parkinson's disease. And if we know what the causes are, we can more efficiently identify effective treatments for it and limit our exposure so that if you have Parkinson's disease, you can, ensure that you're breathing clean air. You can ensure that you're buying organic, that you're washing all your fruits and vegetables with water and a pesticide wash, that you're putting a carbon filter on your water to decrease your exposure to any chemicals that are in it. That if you're one of the 40 million, up to 40 million Americans who get their water from a private well as opposed to city water, that you have your well tested and you have your well tested for pesticides and these dry cleaning chemicals. So what can you do to help us prevent and end Parkinson's disease, to create a world where Parkinson's is increasingly rare, not increasingly common? You can, one, join the PD Avengers. So you can do that right now. Go to pdavengers.com. I'll pause and let you give you a moment to do that. After you join PD Avengers, which is a global grassroots organization created by and run by individuals with Parkinson's disease, you can sign up for our newsletter to learn about additional ways to prevent, care, and treat Parkinson's disease. Both of these are free. You can just go to our website, endingpd.org, and sign up for our newsletter. It'll take you less than 30 seconds to do so. You can tell your representatives to ban paraquat, trichloroethylene, and perchloroethylene. The EPA identified in December and in January that PCE and TCE pose an unreasonable risk to human health. The Environmental Protection Agency concluded that perchloroethylene and trichloroethylene pose an unreasonable risk to human health. If these chemicals pose an unreasonable risk to human health, they should be banned, and sites that are contaminated should be cleaned up, and people who live near these sites should be notified, and people who have their homes, schools, and workplaces contaminated should have remediation systems put in place. You should also tell your representative to endorse the National Plan to End Parkinson's Act, helped created by the Michael J. Fox Foundation, was first introduced into Congress last year and been reintroduced this year. It's time to pass this act so we have a federal plan to prevent and end this disabling disease. Next, you should read our book, Ending Parkinson's Disease. It's available on Amazon or at your favorite bookseller. All the authors are donating all of our proceeds to efforts to prevent and end Parkinson's disease. If for any reason you can't afford a copy, just email us at info@endingpd.org, info@endingpd.org, and we'll send you a complimentary copy. Just let us know your mailing address. Next, we need to hold wrongdoers accountable. We saw what the makers of paraquat have been doing in concealing their risks, at least as reported by the journal The Guardian. If wrongdoers are able to get away with their actions, they're only emboldened and will do even more dangerous things. We need to hold wrongdoers accountable, whether they're producing pesticides or other chemicals that are causing Parkinson's disease, cancer, or other diseases. And finally, we love to hear your stories. We love to learn from you and your experiences with these chemicals or with Parkinson's disease. You can just email us anytime at info@endingpd.org. And so some people say I am a little bit of a downer, but I'm going to end on a high note. In 1938, Americans were paralyzed by polio, and which was causing their children to become disabled and paralyzed, closing down churches, schools, and swimming pools. In that setting, a group of ordinary Americans started a March of Dimes, in which they mailed in dimes to the White House to President Franklin Delano Roosevelt and raised millions of dollars. 17 years later, from 1938 to 1955, Jonas Salk developed a vaccine to prevent polio, and we now live in a world that's largely free of polio. In 1980, a young girl was killed by a drunk driver who had, I think, 4 previous convictions for drinking and driving, and her mother had enough, and she formed an organization called Mothers Against Drunk Driving, MAD. 8 years after the formation of that organization, drunk driving was found to be illegal throughout the United States. The drinking age was raised, and the levels of alcohol in the blood that were permitted were lowered. And today, thousands of us have not suffered from car accidents from drunk drivers. And the beauty of it is none of us knows which of us has been saved by the actions of some courageous mothers. In that same decade, later in the 1980s, a group of activists adopted a slogan of silence equals death, because an unknown virus was killing men in San Francisco and in New York City. Led by Larry Kramer, this motto of silence equals death changed the course of HIV. Today, HIV is preventable and treatable. In fact, more people receive appropriate treatment for HIV today than they do for Parkinson's disease. These are all gifts that we've inherited from previous generations, a world largely free of polio, a world where drinking and driving is socially unacceptable, and a world where HIV is preventable and treatable. These are gifts that we have received. It is time for us to reciprocate and to create a world where Parkinson's disease and many cancers are increasingly rare, not common, and to allow future generations to live largely free of this disabling and deadly disease. Thanks very much.
Thank you for that very powerful presentation, Dr. Dorsey. So we're now going to begin our live Q&A session. Before we do, I just want to go over a few things so everybody knows how it works. We don't take questions directly from the chat room. What you need to do is virtually raise your hand. If you're not sure how to do this, what you need to do is go to the bottom of the Zoom window, second from the right, you'll see a button that says reactions. You'll click on that and then click on raise hand in the pop-up menu. When I call your name, I will unmute you and prompt you to state where you're from and to ask your question. We ask that everyone keep their questions brief and on topic. So with all of that said, we have a question from Deborah, who I think goes by Debbie, if I'm correct. Please state where you're from and ask your question.
Hi, yeah, it is Debbie. I'm from Massachusetts. And what I want to ask you is, I understand that we have to avoid these chemicals and air pollution. And I heard you as, wash your vegetables and fruit and things like that. What I want to know, is there a more active, I want to say prevention or bulletproofing we could do in acknowledging that no matter how hard we try, even that we will have some exposure to these things to either lessen our chances of getting Parkinson's or somehow, I want to be active, and I can't just go test my entire environment and put myself in a bubble. I know that's just not at this point. So I'm trying to look at what are some things I can actively do today to start to try to either prepare my body for what is coming at it, no matter how hard I try, or to, somehow just lessen my exposure in more practical day-to-day ways.
Sure. So one, I wouldn't accept that we need to be contaminated by these chemicals. So, you should let your representatives know that there's no reason that we need to live in a world where we're using chemicals that other countries like China have banned, that Western Europe has banned. So we need to have an advocacy front. So what can you do really tangibly? I'll mention a couple other things. I didn't mention exercise. So vigorous exercise equivalent to 3.5 to 4 hours a week of running or swimming is associated with a 20% decreased risk of developing Parkinson's disease. I'm sure you're hearing a lot about the Mediterranean diet at the Real Truth About Health conference. That's also associated with the decreased risk of Parkinson's disease. So diet high in fruits and vegetables, low in animal products. is linked to a decreased risk of Parkinson's disease and is linked to slowing the rate of progression if you have the disease. I think it's also worth considering that some animal products concentrate many of these pesticides. In our book, we just described one case where cows were concentrating a pesticide that was later found in the brains of individuals with Parkinson's disease. I think it's really important that people, if they can't afford to do so, reduce their exposure to pesticides in all forms of it. It's spring in Rochester, and our yard has lots of dandelions because we don't use pesticides. We're able to afford organic produce. I wash all my fruits and vegetables, even organic ones, with pesticide wash and water. As some of you know, that even organic produce can have detectable levels of pesticides on them. I put a carbon filter on my water. If you're one of those Americans who get their water from their private well, which is not regulated by the Safe Drinking Water Act, I'd have your water tested. Most of the time when they test wells, they're usually testing it for bacteria. So you got to make sure that they're testing it for pesticides if you live in rural areas, or they're testing it for these dry cleaning chemicals if you live in urban or suburban areas. Other things that are linked to Parkinson's are head trauma. So wear a helmet if you like to bike or ski or do other activities that are high risk. And I would actually give some attention if you live in a polluted city that has high levels of air pollution. When you drive through traffic, you can roll up your windows, circulate the air in your car. For Christmas, my children bought their grandfather, who lives in Southern California, an air purifier for his home. And you can think about an air purifier if you live in polluted cities, for your kitchen and your bedroom, to decrease your exposure to these tiny pieces of dust and soot in the air called particulate matter. So there are lots of things that you can do. We also highlight additional things in these black pages at the back of our book on things that people can do to decrease their risk of developing Parkinson's.
Along with decreasing risk, is there a way to exposure? Is there a way to detoxify once you have been exposed?
Yeah, so it's prevention's worth a lot more than the cure. So there was a study looking at trying to remove iron from the brain. So we know that people with Parkinson's disease and other brain diseases have elevated levels of iron. I'm a little concerned that might be coming from air pollution, because these tiny pieces of dirt and soot carry with them toxic metals, including iron from brakes and lead from leaded gasoline. There was a study looking at a drug to remove iron from the brain in Parkinson's disease, but that didn't work. In fact, it didn't work so badly, it was toxic to it. It made people's Parkinson's disease worse and caused other side effects. And that was published recently in the New England Journal of Medicine. So really aren't any good evidence of ways of detoxifying these chemicals. If you have these diseases, I would really concentrate on preventing additional exposure. There's evidence, for example, about air pollution causing or being associated with an increased risk of cognitive impairment in 70-year-old women in Southern California. So even if you're later into life, decreasing your exposure to air pollution may decrease your risk of cognitive impairment and dementia, for example.
Thank you, Doctor.
So it's never too late.
Our next question is coming from Melanie. Melanie, please take up and ask your question.
Hi there. I'm sorry, I was in the middle of something. So I'm curious, I actually got here a little bit late, and so maybe I missed this, but what about the cause of Parkinson's possibly being COVID? Or maybe even the vaccinations. I didn't have a vaccination, but I did have COVID twice. It was after that I got Parkinson's.
So there have been a few cases where viruses can have been linked to Parkinson's disease. The most prominent of what was the sleeping sickness in the 1920s, which followed the influenza pandemic in 1918. Some of you have seen the movie Awakenings with Robin Williams and Robert De Niro. And this is where this sickness, which caused people to develop really huge amounts of fatigue, and then something called catatonia, where they became almost frozen, caused to have Parkinsonism. And these people had awakenings when they were given a medication that's highly effective for Parkinson's disease called levodopa. And there's some suggestion that other viruses have been linked to Parkinsonism. These are likely cause only a small proportion of it. And if you think about Parkinson's disease, these brain diseases, you have to lose 60% of the nerve cells in order for the disease to become manifest, to become visible. So it's really, in my mind, really unlikely that a virus like COVID in a short period of time could cause Parkinsonism. I know that people are looking long-term to see if it does. COVID doesn't enter the brain, as far as we know, so I think it's unlikely to do so. And I've seen no studies linking vaccinations to COVID vaccines to Parkinson's or Parkinsonism.
So what you're saying is I would have had to be in already the prodromal stages or something for COVID to have maybe pushed me over the edge, perhaps.
Yeah, so I think so there are individuals, Parkinson's disease and cancers develop over years. And so many people say, I got hospitalized for pneumonia and all of a sudden I got Parkinson's disease. So if you think about it, the body's probably compensating for different diseases. And if you get sick for whatever reason, that compensatory mechanism may be lost, and you might be in an environment where you're being seen by doctors and other clinicians. And so diseases are more likely to be diagnosed there. But as far as it being a causative factor, I think it's very unlikely.
Thank you. Thank you so much. I really appreciate that.
You're welcome, Melanie.
Thank you. So you mentioned levodopa, I believe it's pronounced. How does dietary protein reduce dopamine by blocking levodopa transport into the brain?
Wow, so we got a very good question. Thank you, Michael. Levodopa is just an amino acid, and as many of you know, proteins are just made up of amino acids. And amino acids are absorbed in the small intestine, just after our stomach. And so, if you take a big meal of protein, a bacon cheeseburger, which I know people paying attention, watching the show aren't doing. If you did that and you took your medicine, levodopa for Parkinson's, you might decrease the amount of levodopa you absorb because you have other proteins and other amino acids being competing for absorption. So for some people, usually people with more advanced disease, it's good to separate the time you take levodopa for Parkinson's disease from protein meals. For people in the early stages of the disease, it's usually not that big of a deal. And sometimes the medicine can cause nausea, so it's better to take it with food. And most people aren't eating bacon and eggs and taking their medicine for Parkinson's disease. Hopefully, people watching this show know that there are healthier diets to follow.
Great, thank you. And now you mentioned, a few chemicals. Are there other chemicals that we should be watching out for with regard to protecting ourselves from exposing ourselves to toxic chemicals?
These are the ones that are best associated with Parkinson's disease. So, people know about the forever chemicals which are really linked to cancer. Other pesticides are linked to other diseases. We should be thinking about what's the benefit we're getting from the use of these chemicals. And so for like dry cleaning chemicals, we use these chemicals so our clothes don't shrink. And the cost of that is cancer and likely Parkinson's disease. I just don't think the trade-off, we're not thinking clearly about the risk-benefit trade-off. There are thousands of people who've likely died from cancer from these chemicals, which are used for degreasing and dry cleaning, and they've been around for 100 years. Companies advertise safer alternatives to these chemicals. It just doesn't make sense.
Thank you. And our next question is coming from Cheryl. Cheryl, please state where you're from and ask your question.
I'm from California. Thank you, Dr. Dorsey, for all your great work. I'm wondering what you think of Dr. Joel Fuhrman's viewpoint that Parkinson's disease in some of his vegan patients, long-term vegan patients, was caused by a DHA deficiency. Do you think that could ever be a causative factor?
I'm unfamiliar with the work and unfamiliar with the association. As I mentioned earlier, people with Mediterranean diet, a vegan diet, are less likely to be exposed to animal products, especially milk, which can concentrate pesticides, and therefore I would think would be at lower risk for developing Parkinson's disease. I don't think a nutritional deficiency in and of itself is likely a major cause of Parkinson's disease.
Thank you.
Thank you. And the next one is going to be Marty. Marty, please state your name. Please state where you're from and ask your question.
Hi, I am from Hollywood, Florida. And thank you for the presentation, very informative. You mentioned the chemical is in the decaffeinated coffee. Is it the same if it's organic, or does that not have it in there because it is organic?
So this was in the 1970s that makers of decaf, that they were using chemicals like TCE and chemicals like it to decaffeinate coffee. My understanding is that those uses have been banned in the United States. So your decaffeinated coffee shouldn't have these chemicals in it anymore, at least in the United States.
Okay, thank you.
Great. Thank you so much, Doctor. And are there any supplements that you would recommend in general health and specifically with regard to, I guess, healing better or dealing better when you have Parkinson's and preventing Parkinson's? I
wish. There have been the supplement that's been studied the most in Parkinson's disease is coenzyme Q10. The brain is about 3% of our body mass, but it consumes 20% of our energy, our glucose. And all these environmental factors I talked about all damage the energy producing parts of cells called mitochondria. So people looked at supplements that would enhance mitochondrial function, including coenzyme Q10. However, a large study of coenzyme Q10, one of the largest studies ever conducted in Parkinson's disease, showed it not to be helpful in people with early Parkinson's disease. So unfortunately, there's no supplement that we know of currently today that's likely to be beneficial for Parkinson's.
Thank you. And so you had mentioned during your presentation about the fights against polio, HIV, AIDS, and breast cancer. Do you and obviously there's a certain critical mass that needs to happen in order for those to have been successful in the past. Do you see that that critical mass accumulating now with regard to the causes of Parkinson's and banning these chemicals?
I wish, 1 in 10 Americans over 65, 1 in 10 Americans over 65 today have either Parkinson's or Alzheimer's disease. 1 in 10, but where's the march been for Parkinson's disease or Alzheimer's disease or ALS? Brain diseases are the leading source of disability in the world. Brain diseases, more than cancer, more than COVID, more than infectious diseases, more than heart disease, are the leading source of disability in the world. And I think many of these, I focus on Parkinson's disease, but I think many of these other diseases have a large preventable component to them. There's no reason that we need to be losing our minds and our bodies and control of our most important functions as a consequence of getting older. We can live in a world that's largely free of these diseases, just like people did likely for centuries before Dr. Parkinson's, where Parkinson's disease was incredibly rare. Why we're paying a really high price for these diseases. Just to give you a flavor, Medicare alone spends $25 billion per year caring for people with Parkinson's disease. That's 100 times more than the National Institutes of Health spends on research aimed at treating Parkinson's disease. We just need to get our priorities in line and think about a world that's largely free of Parkinson's disease, where Alzheimer's disease is less common, ALS is less common. We've done this before for polio. We've done this before for smallpox. We've done it for typhus. We've done it for scrotal cancer. We've done it for cholera. We can do it again.
Thank you. Our next question is coming from Debbie. Debbie, please state where you're from and ask your question.
Hi, yeah, thank you for letting me ask another question. I want to ask something. I'm not sure if it's going to come out right. My father had Parkinson's and died. So I guess what I'm looking at is I'm thinking my lifestyle has been a little different, and I've adopted a lot of these concepts that you were talking about a long time ago as far as prevention. And it seems like there's been some effort, although not very good in the United States, for some of these chemicals, like you said, to be banned and replaced. So what I want to know is, like, statistically wise, as we see those older generations pass away, would you expect Parkinson's to go down, or is there an actual statistically like increase of Parkinson's in younger people, or starting earlier, or like, is it something that you see moving in the right direction because, and the other factor is that people live longer. So maybe they would have had Parkinson's before, but they died of something else. And now that they're living longer, that loss of Parkinson's is coming out because people are successfully staying older longer. So I'm just wondering if any of the efforts of either people to eat better, be healthier, like my father didn't exercise and things like that, would those things start to maybe shine through, hopefully, in any way, or it's not happening?
So Debbie, very sorry to hear about your father. Parkinson's disease is now the 14th leading cause of death in the United States, 14th leading cause of death and rising rapidly. The health we have today is a reflection of the environment that we've had in the past. The health we have today is a reflection of the environment that we've had in the past. And so if we had high levels of TCE in the past, we're going to pay the price now. If we've had high levels of pesticide in the past, we're going to pay the price now. If we've been smoking and been exposed to secondhand smoke and air pollution in Southern California and traffic, we're going to pay the price now. So what we need to do is make our environment cleaner now so that future generations are at lower risk of developing this disease. And we saw that in the Netherlands, where the environment got cleaner and the rates of Parkinson's disease got better. We've seen the flip in China, where the use of pesticides is increasing. Use of trichlorethylene in China is half the market. It's increasing. Air pollution in China is increasing. People in China living there are going to pay a really high price in terms of their health in the future. If we create a world where our water is clean, where our air is clean, where our food is clean, we will all live longer and, more importantly, healthier lives. These are all things that are eminently achievable. You know, we spend 40% more than any other country on healthcare in the United States. And our life expectancy is less than that of our peer nations. Americans live 5 years less on average than people in France. And we spend about twice as much on healthcare. If we focus on the environmental determinants of healthcare, clean air, food, and water, we can all live longer, healthier lives, free of diseases like Parkinson's disease, free with less incidence of cancer, less incidence of Alzheimer's disease, less incidence of ALS. And this would be a great gift, not just for us, but for future generations as well.
Doctor, you mentioned a cleaner environment. Is this, are the chemicals that you mentioned that contribute to the increase in Parkinson's disease, are they something that can be cleaned out of the environment?
Yeah, absolutely. So we can stop using these pesticides like paraquat and reduce our exposure to it today. And people are, you spray these pesticides and you inhale them. It's worth knowing that almost all these chemicals are inhaled. Our nose may be the front door to our brain. One of the earliest features of Parkinson's disease and Alzheimer's disease is loss of smell. One of the earliest pathological findings is the misfolding of these proteins in the smell centers of our brain. I told you TCE is really hard to clean up, but it's really easy to prevent people from getting exposure to vapor intrusion by putting in remediation systems. The average cost of these systems, I'm told, is like $2,000. If you have a $200,000 home, a 1% investment to make sure that your kid doesn't breathe in these toxic chemicals, which kids in Newport Beach, California, where I went to high school, are breathing in these chemicals right now as I speak, because they are living on top of a former aerospace facility. They can decrease their risk of ever developing leukemia as a child, develop their risk of decreasing the risk of developing cancer as an adult, and decrease their risk of developing Parkinson's disease as an older adult. It's also worth noting it's not just aging, longevity and how long life allows these diseases to unfold. If everyone died at age 40, none of us would get lung cancer. You need to live usually to your 50s or 60s to develop lung cancer. In fact, if you look at the graph of the number of new cases of lung cancer as a function of age and the number of new cases of Parkinson's as a function of age, they're indistinguishable. I don't think any of us would say that lung cancer is a disease of aging or a natural consequence of aging. And I don't think Parkinson's disease is a natural consequence of aging either. It's a natural consequence of the environments that we're creating for ourselves.
So given that other countries have banned these very toxic chemicals that have been so strongly linked to Parkinson's, and I'm sure other diseases, why do you think that the United States government hasn't banned them and allows them to persist in our system?
I think there are a couple of things. One's agnotology, the deliberate production of ignorance by these companies. You saw what the makers of paraquat have done, and they succeeded. They had a campaign of freedom to sell. And not only, they had this research, right? Their own research, which was far ahead of the academic research, linking exposure to paraquat to symptoms of Parkinson's disease in laboratory animals in the 1960s. They had this information. Did they withdraw the chemical? No. Did they introduce a safer alternative? No. They doubled down. They adopted a campaign, according to The Guardian, called it freedom to sell. And that freedom to sell has led to a freedom to create, increase the risk of Parkinson's disease for thousands, if not millions of people throughout the United States and around the world. So that's one reason. Two, we need to look at regulatory capture, which is control of regulatory agencies by the industries. You saw this with their campaign to discredit my colleague, Dr. Debbie Corey-Schlechter, across the street by preventing her from serving on the EPA advisory panel related to pesticides. They hired a third-party lobbying firm to discredit her in private to the EPA and installed an industry-friendly scientist in her place. They have succeeded in this. If we allow wrongdoers to continue to market their products that they know are unsafe to our health, and we allow them to get away with it, they're only going to be emboldened and only going to seek to do more of it in the future. And again, this isn't my opinion. This is what The Guardian reported, and you can just Google Guardian and paraquat and read the article yourself.
Our next question is coming from Gail. Gail, please state where you're from and ask your question.
Hi, I'm from Boise, Idaho. And I'm just curious, you gave a great presentation on how to prevent Parkinson's, and also that there's obviously no cure. But I'm just curious, if someone has already been diagnosed with Parkinson's, can the progression actually be stopped by doing things of the same protocols of preventing?
Yeah, so it's never been studied. And I think that's an indictment on us, us, the research community, that we're not evaluating what's the effect of air pollution. So we know there have been a couple studies in air pollution suggesting that people with Parkinson's disease exposed to high levels of air pollution are increased risk for having hospitalizations. But if I had 60% of my nerve cells that produce dopamine in my brain died off because of environmental risk factors or genetic factors, I would be really, 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 really concentrating on how to protect those remaining 40%. And I think breathing clean air, avoiding any exposure to pesticides. We mentioned, on your yards, we didn't talk about golf courses, but, that's another means by which people are exposed to them. Some live in rural areas and they're sprayed, and communities where pesticides are still sprayed. I would think about ways of mitigating my exposure to pesticides. And I'd make really, really sure that I didn't live near a dry cleaning or industrial or military site that was contaminated with TCE. There are tens of thousands of these sites throughout the United States. If I lived near one of these facilities, I'd have my indoor air tested to make sure that I'm not still being exposed to chemicals that are very likely damaging to the nerve cells in my brain that are important for Parkinson's disease. One thing that people can do, in addition to doing all those things to mitigate risk factors, is exercise. As I mentioned, is decreased risk of Parkinson's disease. Vigorous exercise enough to make you sweat a little bit, likely releases growth factors in the brain that protect the remaining nerve cells that people have. That's another way people who have the disease can help modify their disease course.
Thank you very much.
And Doctor, you mentioned how when you actually start seeing symptoms, it is a long time since you started losing those nerves. You have to lose 60%. But how long does it take to be exposed to these chemicals and have the onset of the disease?
So we don't know. If you look at every dollar that's spent on Parkinson's research, only 2 cents is spent on preventing Parkinson's disease. So out of every dollar spent on Parkinson's research, only 2 cents is aimed at trying to prevent the disease. In medicine, we know we have this dose-response relationship, that the larger the dose, the greater the likelihood of response. So we know, for example, in smoking, the more cigarettes you smoke, the higher your risk of developing lung cancer. We also know in smoking that the sooner you stop, the sooner you can get down to almost a average person's risk of smoking. And we know that, within seconds of you smoking your last cigarette, that levels of carbon monoxide, for example, in your blood decrease. So I can't give you a straight answer on how much dose you need. We know that farmers, for example, are at about 150% increased risk of developing Parkinson's disease. People who live in rural areas and get their water from wells is about a 75% increased risk of developing the disease, suggesting that there's a dose-response relationship with pesticides. I think it's pretty clear that there's likely a dose-response relationship with air pollution, and likely a dose-response relationship with exposure to this dry cleaning chemical also used in degreasing.
And what about head trauma and its effects on Parkinson's? Like someone like Muhammad Ali was famously at least thought to have Parkinson's disease, and it was believed from the boxing. And then we have football players having issues from concussions and heading the soccer ball for soccer players. Is that the same disease, and how much of a role does head trauma play in Parkinson's disease?
Yeah, so our book devotes a whole chapter to it. Michael Oken wrote a piece, one of the co-authors, about Muhammad Ali's Parkinson's disease, and with his family's permission, he helped care for Muhammad Ali, and so he thinks that head trauma played a role in the development of his disease. And we know that a significant head trauma or even repeated head trauma increases your risk of Parkinson's disease and other brain disease, especially dementia and Lou Gehrig's disease or ALS. We also know that head trauma has a synergistic effect with other environmental exposures like pesticides. So, if you give a laboratory animal head trauma and pesticides, I know it's not very nice, their risk of developing Parkinson's disease is amplified. And so we also know, like, again, the smoking analogy, only 10% of smokers develop lung cancer. Not every farmer is going to develop Parkinson's disease. Not every pesticide worker or landscaper on a golf course is going to develop Parkinson's disease. Your risk is higher. There have to be other environmental and genetic and likely chance or bad luck factors that explain why certain individuals who are exposed to these chemicals develop the disease and why some don't.
Tell us about the current treatment for Parkinson's disease and what future medicines look like, and are there any natural approaches?
So the best natural approach is to exercise. So I tell people with Parkinson's disease, if they can, they should exercise at least an hour a day. And if I had Parkinson's disease, I would exercise at least 2 hours a day. And so walking, jogging, swimming, bicycling with your helmet, ballroom dancing, yoga, Tai Chi have all had demonstrated benefits for Parkinson's disease. As I alluded, Parkinson's disease is loss of dopamine-producing nerve cells in the brain. The most effective medication developed in the 1960s, if you can believe it, is a medicine called levodopa, which replaces it. And for individuals with Parkinson's disease, the benefits can be quite significant. Like all medicine has some short-term and some long-term side effects. And the disease progresses over time, which makes the response to medication less than optimal. And then for about 5 or 10% of individuals who have Parkinson's disease and respond to medication for developing complications, surgical treatments like deep brain stimulation can be highly effective and sometimes even transformative for some individuals with the disease.
Our next question comes from Melanie. Melanie, please state where you're from and ask your question.
Hi, thanks for taking my question again. I'm in New York City, and I'm wondering about on the same line that we're speaking of right now. I mean, I was vegan for 12 years before I got diagnosed. I exercised, I did a whole bunch of things, and still here I am being diagnosed. So I'm pretty sure it has to do with a well that I had. I was living in an agricultural area and drinking from a well, and not knowing that I had to test for something like that. But I wonder about, ways to address it that are not levodopa, because I'm trying to avoid levodopa. And I have this sense that I will develop dyskinesias if I do. And I definitely think that that's much worse than the tremors I currently have. And I wonder about things like cannabis or amino acid therapy. I know Dr. Hinds developed a protocol for amino acid therapy. So you were already speaking about some of the alternative ways to deal with it. But I mean, levodopa has been around since the 1960s. Isn't there anything new we can do that's not cutting our head open and planting a brain implant, you know?
Yeah, so we needed, as you allude to it, the most effective treatments for Parkinson's are old, and it's an again indictment of researchers like me that we need to come up with more effective treatments. And medicines aren't for everyone, and some people want to avoid the side effects of medications, including a long-term risk of dyskinesias, as Melanie said, which are increased involuntary movements which happen after long-term exposure, especially at higher doses to the medicine. I wish I had really good answers for you. The best answer I have for you is around exercise. And so I've had patients who, rather than starting medications, have opted to do exercise. And they often do it for a year or 2 years, sometimes even longer without the need for medicine. I have one veteran who's used to be on levodopa, doesn't take levodopa, and just exercises a ton. I think his function would improve if he took a small dose of the medicine, but he's opted not to, and that's perfectly reasonable. Levodopa is also found in a plant called Mucuna purines.
Yes, that's what I'm taking, actually, or trying to.
As you're probably aware, the challenge with using this plant is called the velvet bean plant is, the dosing is, not as well controlled and not as certain, from one supplement to another. But that's a reasonable option for some people to consider if they're really reluctant to start medications. And then I mentioned also the diet, which you're already on, even more than a Mediterranean diet to decrease your risk of exposure to these chemicals.
And what about CBD and THC cannabis, which is now around?
So cannabis is best studied in Parkinson's disease to help pain. Some individuals with Parkinson's have non-motor features, so features that don't have to do with movement, that don't have to do with tremor or walking. And that's been shown to be helpful for those individuals. And some people who have nausea, cannabis has been shown to be helpful. In my estimation, it's unlikely to be a game changer for most people with Parkinson's, but for helping these symptoms, it can be helpful on the margins.
So I just want to be known for this experiment that I've tried. And I'm actually, I find that when I do take these tinctures that are, 1 to 2 ratio of CBD and THC, I do actually have lessening of my tremors. Maybe it's just that I don't care as much. I don't know, but I definitely feel better. And so I'm just curious, am I harming myself by doing that? That's all.
Well, all medicines have side effects. So there's just no way of getting around that. And there are some reports of cannabis and marijuana helping with tremor. So you're not alone in your experience. There's just no free lunches. The free lunch is to prevent diseases from ever developing in the first place. That's our free lunch.
Right. I'd rather have the munchies as a side effect than dyskinesia. Dyskinesia is a little more unwanted. Thank you.
I wish you the best, Melanie.
All right. So in your book, you talk about policies and research funding that we need. What kind of funding do you think we need in order to get stuff moving, make people aware of the links that you have talked about in your presentation today? Well, to get it and get stuff done so that we can rid ourselves of these chemicals once and for all.
Well, we saw what an Operation Warp Speed did for COVID. Why don't we have an Operation Warp Speed for brain diseases? I highlighted that the NIH spends 1% of what 1% of what Medicare spends caring for people with the disease. What if we flipped it around? What if NIH spent $25 billion in developing new ways to prevent and treat Parkinson's disease, and we only spent 1% of that money on caring for people with the disease? We mentioned the success of $2 billion of NIH funding per year for HIV, and how many of us live free of HIV? How many of us don't have HIV because of increased research funding and because of the work of activists? There are certainly some of the people listening here or be listening previously that don't have HIV because there are significant investments in HIV. NIH spends only 1/10 the amount on Parkinson's as it does on HIV, and Parkinson's affects roughly the same number of Americans. as HIV does. We're letting a chemical company sell paraquat, and the company, according to The Guardian, makes about $400 million in revenue on paraquat. If paraquat only accounted for 2% of people with Parkinson's disease, Medicare would be spending more per year than the company that makes paraquat does in its global sales, not profit sales, of the pesticide, the weed killer. If we make investments in preventing disease, we'll reap enormous benefits in long-term health, decreased health expenditures, and a happier and healthier population and more productive population than we currently are doing right now.
If we got rid of these chemicals in our environment, would we end Parkinson's disease?
I think Parkinson's disease would be really, really rare. I mean, Dr. Parkinson said it was rare in 1817. None of the, people were in their 60s, 70s, and 80s in the 1800s. George Washington died at 67. John Adams at age 90 was writing letters to Thomas Jefferson, age 84. Neither of them had Parkinson's disease. Ben Franklin, Abigail Adams, none of them had Parkinson's disease. In fact, I only know who the first American to be diagnosed with Parkinson's disease was. Diseases like Parkinson's disease are likely a product of our modern society. There's no recounts of Parkinson's disease like in the Bible. I mean, the Bible has stories of epilepsy and heart attacks and things like that, but doesn't have Parkinson's disease in it. I think we could easily have a world where Parkinson's disease is incredibly rare instead of incredibly common.
Okay. Now, you mentioned about organic food and rinsing your food off. The EWG talks about, has their Green 15. Their Clean 15 and their Dirty Dozen. The Clean 15 being food that you can get conventionally, which probably has pesticides on it, but isn't going to necessarily have an impact on you. What do you think about eating conventional foods that are labeled okay to eat with low toxicity?
So, I'm not an expert in all of this. I'm a neurologist and not a toxicologist or environmental scientist. And, it's deeply disturbing to me that foods labeled as organic have pesticides on them. So foods labeled as organic have pesticides on them. In addition, my understanding is the FDA or Department of Agriculture, when they set these standards for what's acceptable levels of pesticides, do so after the produce has been washed with water. So, I no longer, buy an apple from the grocery store and eat it without washing it. It's concerning that in a country that is the wealthiest in the history of the world, that we can't trust the food, water, and air we consume, breathe, and drink and eat, that we can't trust it. I used to trust that the food I ate was safe, the water I drank was safe, and the air I breathed was safe. I no longer do so.
Thank you. And it's out there about bell peppers reducing Parkinson's disease. Do you know anything about that? No. Okay. And last question. How does turmeric improve motor performance in Parkinson's, and does it have any sort of improvement?
There have been a couple of studies on turmeric. Unfortunately, I'm just not very familiar with them. I think sometimes we get, we're desperate, right? You have Parkinson's disease, you're going to spend 10, 20 years with a very disabling disease that Brian Grant, the former NBA basketball player who has the disease, says sucks. And people are looking for alternatives to it. Medications, surgeries all have their drawbacks and side effects. I think we need to really think about working really hard to create a world where we don't have these diseases. I mean, who wants to be cured of breast cancer? I mean, who wants to be disfigured? Who wants to be radiated? Who wants to be filled with toxic drugs? Who wants to have their hormones manipulated? We can create a world where 1 in 8 women don't get breast cancer. We can create a world where 1 in 8 men don't get prostate cancer. We can create a world where 200 Americans aren't diagnosed each day with Parkinson's disease, where 100 Americans don't die each day with Parkinson's disease. If we summon the will, if we make our voices heard, we can create a world where our water is safe, our food is clean, and our air is clean. If we do so, we'll all live healthier and likely longer lives, and spend a lot less money and a lot less suffering in the process.
Thank you so much, Dr. Dorsey. That was a very informative presentation. Please open up the mics, and thank you again.
Thank you so much. It was awesome.
Thank you.
Loved it.
Thank you for this.
Great.
Wonderful. Thank you.